We need to have a standardized of pharmaceutical reps.
The people that provide education, the doctors.
Who is the chairman and CEO.
The fascination the public has. The impact on society, the impact on unemployment.
We are the consumers of healthcare. We need to have the knowledge to know how to navigate this complex system.
Hey everyone, welcome to the Unscripted Podcast. Today we have a really special guest. I'm very excited to welcome Sonja Allen to the podcast. Welcome, Sonja.
Thank you. I'm excited to be here.
Yeah, we're excited to have you. So Sonja is the managing director of the nonprofit organization, the Marshall Allen Project, and the Allen Health Academy. She's also a women's minister at 121 Community Church, and she leads efforts to advance healthcare education and services while also guiding and supporting women in their spiritual growth, which is great. Her work bridges the gap between physical well-being and faith, and trying to really empower people when it comes to healthcare and ministry. And Sonja, of course, for many that don't know, was actually the partner to her late husband, Marshall Allen, who was a very well-known, renowned patient advocate and healthcare investigative journalist. So really excited today to learn more, Sonja, about Marshall and his mission and, you know, your efforts to continue that legacy and honor the work that he did. So again, welcome to the podcast. Very excited to talk to you.
Thank you. Yeah, thanks a lot.
Absolutely, my pleasure. So, I looked at your background and I saw that you are currently a minister. Is that correct?
Yeah.
All right. And one of the things that I thought we'd start with, because right now, you know, we're filming this, it's the middle of June, right? Today's, I think, June 18th, June 20th. Today's June 20th. And there's a lot going on in the news, right? A lot of people are anxious about what's happening with global events and things like that. And one of the things that struck me about your background was that, you know, you try to reconcile physical well-being and spiritual well-being as well. And I thought that was really interesting. And I don't think a lot of people focus on that necessarily. So a lot of people sometimes when they watch the news, and we'll get into healthcare news later, but whether it's what's happening now in the Middle East with Israel and Iran or whatever it is, people get anxious sometimes. So I'd be curious. I think people would like to know, for those that watch the news and get worried or get anxious, maybe what advice you have for people listening who are worried or concerned about some of the global events happening. You know, how do they kind of quell some of those fears, calm themselves down?
I think that's obviously a great question. I feel like it would be impossible for me to address that question without couching it in my understanding of faith. And so to me, you know, I believe in a holy sovereign God who's in control. And so when I look at the world and I see the world spinning out of control and all of the things that we have to fear, I do feel anxious and I can feel very worried and very afraid. But when I shift my perspective and look to my Heavenly Father, who has the world under control, despite it seeming like it's not under control, that I know that there's a future, I know that there's a perfect plan, I know that there's a God who I can trust and who I can believe in and who I can have faith. So it's a matter of shifting perspective. It's like when you look at, you know, a problem that you may even just be experiencing in your personal life, like a wayward child or a difficult marriage or an illness or something like that. It can be so very all-consuming, but when you shift your perspective outside of yourself and about looking at the greater community or looking at other people who may also be suffering or struggling, or looking to God, who ultimately is a solid and firm hope, then it changes. It releases that stress and the anxiety, because now I don't have to be in control, because somebody much greater and stronger and more powerful than me is in control, and I can trust that. And that doesn't mean that life is perfect, or that life is guaranteed to be full of suffering, as we all know. But so it's I can only address that question in that kind of context, because that's, you know, what I believe to be true.
No, I think that's great that you shared that. And like I said, I think people now especially need to hear that, because information is good and bad. Information is great because you get access to a lot of important news quickly, but sometimes the overflow of information can also make people nervous and anxious. And I've been talking to a lot of different people, and they're nervous, you know, about what's happening today globally in the world, and for a pending war. So I think people need to hear that. And when you said that, I thought of the verse when Christ says, in the world you'll have tribulation, but be of good cheer, I've overcome the world. And I think, that's really important that we remember that in the end of the day, we have to trust in God's providence. And that brings me, I guess, to your background, because I saw that you grew up in Kenya, and what took you there, I guess, was your parents were missionaries, right? With the Navigators, I believe.
Yeah,
So
that's right.
talk to me about that, like how that shaped, how growing up in Kenya shaped, I guess, your perspective on what's happening in healthcare. Because the healthcare system here, is very different than what we see outside of the U.S. We, at our organization, the company that I run, the ACMA, work with many different pharmaceutical companies all over the world. And a lot of the healthcare challenges we face here in terms of our healthcare system is very different than what we see outside. So I'm curious, what was that experience like, and how has it helped to kind of inform your perspective today in the U.S. and the healthcare system here?
I mean, I absolutely loved growing up overseas. I didn't really obviously know any different. I was born in Norway and lived there till I was 4, and then when I was 5, we moved to Kenya, and I lived there for 10 years. So I didn't really have any experience of living in the States until I moved to Colorado at the end of my sophomore year of high school. And so for me, I think the thing that I loved about it is just it broadens your worldview. It gives you a much greater and deeper understanding of suffering and of poverty and of hardship. And so I think there's value to that. I think in the United States we can be so geographically isolated in a way that we don't really have a great understanding of different cultures and things like that. Even though the United States obviously is full of people from different cultures, but people do tend to like silo themselves into their own communities. So in Kenya, where I grew up, my sister and I went to an international high school, and there were like 63 nationalities in my high school of about, 500 people. So
Wow.
you have a great exchange of, backgrounds and faith beliefs and experiences that really enrich your understanding of people and of faith and of suffering and all those kind of things. And so I think living in Kenya, where we lived in Kenya like in the 80s, and then Marshall and I also lived there from 95 to 98. And those were really some kind of golden years of Kenya. They had gotten their independence from the British, and so it was a great time of like flourishing in the country at the time. And so for our family, like my parents worked with Kenyans. We had a lot of Kenyans in our home. Like I just loved it. I loved the experience of it. And as far as healthcare, it was kind of interesting actually because Marshall and I had taken our boys back to Kenya. It was in 2019. When I was there, I actually got really sick. I had this terrible migraine. I used to suffer with migraines quite a bit, and was really not feeling well to the extent that I was like, I've got to go to the emergency room. Like I need either some morphine or something to kind of just break the cycle of my headache. I really couldn't get over it. And so we end up going to Nairobi Hospital and walked in and said, okay, this is what I'm dealing with, and this is the situation. And then they told us up front, what the cost of the doctor's visit would be. And it was like $50, I think, or something. And then we went in and we talked to the doctor, and he's like, okay. And he gave me some prescriptions and went to the pharmacy and fulfilled those prescriptions. And everything was up front. The prices were up front. The service was excellent. And I thought, gosh, I wish it could be like this in the States. Sort of this experience. You think here you are in a third world country, here you are in Africa. You think that it's going to be dangerous or subpar in some way, and it wasn't. It was actually, I think that the thing that really stood out was just knowing what the prices were ahead of time, knowing exactly what the expectations were. Everything was out on the table. There was nothing hidden. There were no bills that they sent us later in the mail. It was just straightforward, and that was amazing. So that's kind of the healthcare side of it. When I grew up there, I mean, I didn't probably experience it in the same way because my parents were the ones kind of more dealing with the healthcare side. But growing up overseas, it's a wonderful experience. It just broadens your view and your perspective of life.
Oh, I can imagine. And so how did you end up meeting Marshall?
So we met in college. Kind of a funny story. I went to the University of Colorado in Boulder, and he had gone to a school in Denver for 2 years and then transferred up his junior year up to Boulder. And we had a lot of mutual friends in common. And so I had heard from a friend of mine that, Marshall was this great dancer and that he was going to come and he was going to dance, or he was coming to this dance that I was attending up in Boulder. And so I knew who he was. I knew his name, but I didn't know his group of friends as well. And so I saw him at this dance, and he was dancing with this girl and all her friends. And I really wanted to dance with him. We were into country swing dance back then. And so I noticed him at the dance, but I didn't ever talk to him. And then he actually noticed me at the dance, and he asked his friend what my name was. And the guy, he said, well, that's Sonja Van Wyk. That's my maiden name. And then fast forward 8 months, and I went rafting. So Marshall was a whitewater rafting and mountaineering guide in the summers in Colorado. And he worked for an outfit called Noah's Ark. And so I had worked at a camp that summer, and my staff at the camp, we went rafting at Noah's. So I'm floating down the river, and Marshall is not in my boat, but he's in the boat next to mine. He was part of our group, but I hadn't noticed him. And then he sees me in his buddy's boat, and he's like,
He remembered you.
Yeah.
Wow.
He said he would be much better at telling the story than I am. But anyway, he said that he saw me, and immediately my name came to mind from that conversation that he'd had 8 months earlier. And so he saw me, and he's like, hey, Sonja. And then when I turned around and looked at him, he realized we've never talked. And he was like, I'm Marshall. I saw you at a dance in Boulder.
Wow.
And so everybody in my boat was like, who is that? And I was like, well, I've never met him, but I think that's this guy Marshall and whatever. And everyone was teasing me. And then, an hour later or whatever, we get off the river, and he's like, all, cool and Mr. Cool, whatever. And he's like, I just, yeah, we have some mutual friends in common, and I'm transferring up to Boulder, and I'm sure I'll see you there, And so anyway, we get up to school, and we were both English majors, so we had a bunch of classes together, and we were part of the same ministry on campus, and had a great group of friends, danced together all the time. And at the time, he actually had another girlfriend, and then when they broke up, we ended up getting together. And it was before we ever went out on a single date. He told his friend Dave, he was like, just for the record, I'm going to marry Sonja. He's like, I just want to put it on the record.
So he knew.
He knew. Yeah.
He knew. He had that feeling. Yeah. That's how it is sometimes. And you guys have how many children do you have?
We have 3 boys.
Very nice. Very nice.
Mm-hmm.
And I would imagine, it hasn't been easy this last year for you guys. I can only imagine. Speaking of healthcare, I from what I read online, at least, Marshall had passed from a sudden heart attack, correct?
Yes.
And where did he have any symptoms before? Because he's relatively young, and I think a lot of people watching, that's one of the first things they're going to wonder is, were there any symptoms, any signs, any concerns?
Mm-hmm. He really didn't, and that's what has been really strange about the whole thing. He actually had a full physical in February before he passed away in May, and the doctor said, he was fine. There was nothing, he'd had maybe a little bit of high cholesterol, but it was just the kind of thing that it wasn't high enough to require a statin or any kind of medication. He just said, well, you need to just watch what you eat a little bit. But he worked out, he wasn't overweight, he didn't drink, he didn't smoke, he really had no sign at all of there being anything pending or anything coming. I know people have asked me that, the irony of him, holding the healthcare industry, feet to the fire, and then him passing away in the way that he did. But really, the heart attack just, it was almost like he'd been hit by a car. It was almost that random. It just didn't feel, um, there was absolutely nothing that would make us think, oh, this is, you know, this is going to be a problem. So yeah, I don't know.
Yeah. Yeah, it's scary, right? Because like you said, he just had the physical, and so you would
Mhm.
think, okay, that's kind of gives you that like reassurance that everything's going to be okay. So that's tough. That
Mhm.
must be very tough, especially when it comes to a surprise like that. So I'm sure
Mhm.
that's not easy. Tell me a little bit about how Marshall first got into investigative journalism, because that's not how he started, and then he ended up in healthcare, I guess specifically. How did that all pan out, I guess?
Yeah, so we had been in ministry, like I said, in Kenya. We were there, Marshall and I were there as missionaries also, doing youth ministry. And he really wanted to come back. We kind of like went over there about 10 months after we got married. We moved back to Kenya. We were there 3 years. And then he really wanted to go to seminary and kind of get more education and training. And so it was like, well, I want to come back to the States. I want to go to seminary and get more biblical training, and then, maybe go and live somewhere long term and do ministry full time. So in the process of going to seminary, we ended up living in California, which is where the school was. And he graduated from seminary, and he had been doing like freelance writing kind of on the side just to make some money.
Hmm.
He worked for a little newspaper, covered some prep sports, like, and then he got writing like freelance articles. And anyway, and I said to him, I was like, we kind of had realized in our time coming back that maybe going back into ministry wasn't the right thing. And during our time in California, of course, everybody's a writer, and so it was just something that I think circumstances and timing and where we were just became like, I said, maybe you should think about being a writer. And because he just came to life when he started writing. He loved it. He was passionate about it. It was fun for him. And so anyway, long story short, he graduated from seminary, and then he got a job at a really small, it was like a twice weekly newspaper. Never had taken a journalism course, never had
Wow.
uh, done any kind of writing like that, but they hired him, and he really learned on the job. And he was covering the courts there in this little town, and so he was talking to the mayor every day and writing 3 or 4 stories a day for the newspaper. He was there for a few months, then worked at a little bit larger newspaper, and then he ended up there for maybe 6 months, and then he worked at the Pasadena Star News, uh, and was there for a few years. And so he was just a natural. He was a great communicator. He was very curious. He loved people. So journalism, he didn't need to go to school to learn to be a journalist. He really was a gifted and natural journalist, just with his personality and his abilities and his talent.
He had a knack for it. Yeah, had
He
a knack
really
for it.
did.
And
Yeah.
what ended up driving him, I guess, to write Never Pay the First Bill?
So when we moved to Las Vegas in 2006 to work for a newspaper called the Las Vegas Sun, and that newspaper was his job there was entirely investigative, like deep dive stories. Instead of having to like churn out 2 or 3 stories a day for a daily paper, this newspaper was kind of committed to that long form, like deep dive investigation. And his editor in Las Vegas is the one who said, "Hey, I want you to cover healthcare." And he'd
Mm.
never covered healthcare. And he said, honestly, his real words were, "I can't imagine anything more boring." And but he started covering healthcare in Vegas and found it to be actually really fascinating. So he wrote a series of stories there that he got a lot of awards for, and he won quite a bit of acclaim for those stories, which in turn led to an opportunity at ProPublica in New York City. So when we moved out there, he continued writing more about investigating healthcare, and it he started writing about, like, okay, so in Las Vegas, he wrote about patients being harmed in hospitals through procedures. And when we were in New York, he was writing about wasted healthcare spending. He was writing about all of these experiences that patients have getting taken advantage of financially. Then he started writing about insurance and how did that happen, and how does the system work, and how do people use that? we're all kind of getting taken advantage of by that. And so all of those years of investigating healthcare and looking at it, he always wrote from the perspective of the patient. So having that experience, he basically just put it all together, and he wanted to write a how-to book on how to navigate healthcare. Like when you go to the doctor, you feel sort of powerless. Like you just go and you give them your insurance and they just send you the bill, and you don't really know what the price is. You don't necessarily know how to compare prices. You don't even necessarily know what questions you're allowed to ask or what your rights are. So all of those years of experience is what led him to write Never Pay the First Bill.
And why do you think it has resonated so much with people?
I believe it's because they feel empowered. I believe that there's this, he has been able to kind of lift up the rock and look underneath it and see what's really under there and see where the financial incentives are, where the power incentives are. Like as the patient, you are funding the entire healthcare system through your employee or your employer, money that gets set aside for healthcare, through the taxes that you pay for, Medicare, Medicaid. So the individual is the one funding this whole system, and you are the least powerful one in the whole system, because the insurance companies and the providers and the hospitals and the government and everybody else is saying, okay, thanks for contributing all this money in this big, huge pot, and now we get to decide who gets what and how that gets determined. And so I think that makes individuals feel really powerless. And so I think the book has resonated because it's been like, hey, this is what you can do. These are the questions you can ask. These are the tools that are available to you. These are the points of leverage. This is what's really happening. And people are like, oh my goodness, this is amazing. I didn't know this. And they can now say, I feel equipped and empowered to take control, at least to ask questions, at least to find the information that I need to make these kinds of decisions. And so I think people have told me it's like it sits on their nightstand right next to their Bible. It's like
Wow.
they appreciate it.
It's like a how-to. Yeah, it's like a how-to to your point. It's like a go-to reference they always have access to. So let's talk a little bit about what's been going on in the last year in the news. There's, of course, this has been a big year for healthcare. You have the tariffs, the Trump tariffs. The FDA this week announced accelerated drug approvals. And then, towards the end of last year, just, 6-7 months ago, there was the unfortunate and horrific murder of a United Healthcare CEO. In that case is still up now for trial with Luigi Mangione, who murdered this individual. I think because he had access issues and delay in care due to prior authorization, which obviously speaks to a lot of the challenges that patients face. In this case, this person went so far as to murder the healthcare payer CEO, which of course is terrible and nothing justifies that or condones that. But I think it speaks to this issue, like you were talking about before, about feeling empowered. So I think a lot of patients in the U.S. who are disenfranchised, who have difficulty accessing services and medications, they might feel powerless. So what are your thoughts on that? I mean, that whole situation, and I see some actual good potentially that can come from it in terms of awareness. But what are your thoughts on this whole issue with prior authorization and just the challenges that patients face in getting access to medications?
Yeah, I mean, I think obviously it's a hideous crime, and it's like you said, nothing will justify or condone it in any way. And I obviously sympathize and empathize with the widow. That's a terrible situation to be in. I think if you look at that event in the context of what's happening in healthcare, it reveals the degree of frustration and anger that people are feeling towards the healthcare system. And I think that part of it is that feeling like being a victim of I am a person who needs healthcare from time to time, and it could be life or death, or it could just be routine. But either way, I go and I don't get the care that I need, and that feels, especially if it's a life or death situation, it can make people feel absolutely desperate to the point of, committing heinous criminal activities.
Right.
So I think what it is to me is the stress and the pressure of our experience of healthcare has just been increasing really over the last probably 20 or plus years. And where I think until people feel the actual pain point, it's very hard to get people to engage and to integrate with healthcare. Like, we have this solution that that Marshall has come up with in his book, and then also our AI, and we can explain more about that later. But in order to get people to actually go and figure it out and read their bills and ask the questions and do the things, it's very, very hard because it's a pain in the neck. And we all have really busy lives, and we don't really want to spend our time trying to understand how the benefits work and everything like that. So I feel like that event was indicative of the level of angst and financial stress, emotional stress, you know, all related to healthcare or to getting prior authorizations or to paying for healthcare, that it's just this growing mountain of frustration that people are experiencing.
Did Marshall ever tell you kind of just, between the two of you, why he thinks the healthcare system here is so complex here in the US? I'm just curious. He'd been doing a lot of, obviously work in this area. What was his take on why it's so complex? I think that's what a lot of people want to know.
So he looked into the history of how did the system that we have get created, and my understanding of it is that it was created through when they were building railroads, and that employers were sponsoring healthcare for their employees. So as the railroads were moving across the country, that's kind of the idea of like the company town kind of situation where you work for the company and then the company provides your healthcare, it provides a variety of different things for you. And so I think the problem with that is that you have this intrinsic middleman who is in the way, really, in a way, right? And so, like, we have now this system where you have these, you have these insurance companies, and then you have your employers who are contributing for your healthcare, and then you have yourself as the patient, and then you have the provider. And all of those relationships have an intrinsic motivation.
Mhm.
And, we obviously have an altruistic, like you assume a doctor is there because he wants to care for a patient. He wants to heal
Right,
them. He wants to
right,
help them. But the system that we have is so based on money, and money, the love of money is the root of all evil, right? Money does corrupt, and so nothing wrong with money, nothing wrong with practitioners and people making a lot of money. It's just, where does that money come from, and where do those incentives align? And I think because the crux of the problem is the system was created where you have this middleman, in the
mhm.
middle of these relationships, that makes it just convoluted. That may be a very simplistic explanation, but I know that's one thing that he actually wrote about even in the book, was just to say, you know, it we don't have a direct relationship between the
Right.
patient and the doctor. And I don't mean just the employers being middlemen. I mean these insurance companies. It
Well,
makes
well, I
makes it
mean, the
hard.
example, yes, the example you gave about your story in Kenya when you had the migraine, you go in, you
Mhm.
know up front what you're going to pay. I mean, the way it works in the U.S. is I could go to the hospital, you can go to the hospital, we can get treated for the same thing. You might be charged something totally different than me. Why? No
Mhm.
one knows. Sometimes they don't even charge or bill the insurance company. Again, why? No one knows. What they reimburse is not transparent either. So there's a lot of issues. And then, of course, you mentioned the middlemen. I'm assuming you're referring to the pharmacy benefit managers, also who really, because of their rebates, drive up costs. So I would agree with him. I think the middlemen definitely play a big role in
Mhm.
driving up the cost and just make everything very, very complex. What are some of the biggest lessons you think people take away from Marshall or the book And then maybe talk to us a little bit about the Mac, the AI tool, the Mac, and a little bit about what that is, and who kind of can use it, and some of the benefits.
I think so, yes. I think one of the things that people get out of reading Marshall's book is some really practical tools and tips to say these, like, here's a very simple example. You can go to a hospital or a doctor's office or any practitioner, and you can ask what the cash price is for the procedure. Even if you have insurance, you are allowed to ask what the cash price is under HIPAA. Now, some doctors will say, you're not allowed to pay the cash price because you have insurance. That's not true. So I had a friend, for example, who was getting an ultrasound, and she got billed by her insurance company, like, I think it was $5,000. The insurance company paid like $3,500, and she was left on the hook to pay $1,500 for this ultrasound. Well, that's not a fair price for a simple ultrasound. So I told her, I said, well, go to the doctor's office. Did you ask what the cash price is? And she said, oh, I didn't know I was allowed to ask what the cash price is. So that's a simple example of giving someone the ability to go and find out information. That's what we want. We want information so we can make the best choice. You could say, oh, this place, the cash price is X amount, and this place it's, whatever, and you can decide, do you want to go here or do you want to go there? How much money do you want to spend? And I think that is, again, a simple example, but a powerful example of what knowledge and information and access does for us as consumers. We are the consumers of healthcare. We need to have the knowledge to know how to navigate this complex system. It's like Marshall wrote a lot in his book about, if you went to McDonald's and you ordered your burger and fries and they just charged you $100, you'd be like, well, hold on a second. I didn't want to spend $100 for my burger and fries. So you, without knowing what the prices are, you're powerless. So equipping people with those questions, there's hospital financial assistance programs that a lot of people don't even know exist. Well, when you know that they exist and you know what the limits are, they're actually much, much higher than anybody assumes. So we might think, oh, well, we make a decent living, we'll never qualify. Well, there's a lot of people that will qualify for hospital financial assistance. And so those kind of things are very hidden and they are hard to access. Getting prices for things is hard to access. So I think his book and his AI tool really highlight that, and it makes a difference for people.
Tell us a little bit about the Mac.
So the Mac came about a month prior to Marshall having the heart attack. He found this program where you could clone yourself into an AI tool, and so he was super excited about it. And so he wasn't all that techie necessarily, but this was a program that kind of did it for you. And he was able, just because of all of his writing and his speaking and everything else, to download over 475 articles. He put in his entire book. He put in podcast conversations, speaking notes, all the things that he had kind of contributed to the healthcare conversation in the last 20 years into this clone. And then you talk to it and you ask it questions and you make sure that it's giving you accurate information. And there's links to his YouTube videos and to his podcasts and to his, pages in his book or articles that he wrote for ProPublica or whatever. So there's other healthcare companies that he was very aligned with who are doing the same type of work with links to websites and all of that. So it's this really, really practical, useful tool that peels back, this opaque darkness that we live in and trying to understand healthcare and navigate the system. And it gives people real, true, practical information. So if you get a surprise bill, you can ask the Mac, and it tells you, like, it will have a question and it will spit out, number 1, do this, number 2, number 3, number 4, number 5, here's a website, here's a link, here's an article for more information. The Mac will write you a letter. It will write an argument for you. It will communicate for you. Like, it is a very useful tool. You can say, what questions am I allowed to ask when I go to the doctor's office? hey, I got billed this amount. How am I supposed to fight this? What are the tools and the information that is accessible to me? And so I've had people tell me they use it while they're on the phone with their insurance company and they're on the Mac at the same time, asking questions, looking up pricing, getting, real-time help and information. So
Wow.
it's a powerful tool. And Marshall, he actually recorded his voice. And so you can talk to the Mac or you can, ask it questions just like any AI tool. And it speaks 115 languages, which is a huge benefit for people who are here who don't speak English. It's
Oh, yeah.
hard enough for English speakers to navigate healthcare. Imagine if you didn't speak
Mhm.
the language. So there's a lot of incredible application for using it, and it's literally as simple as having a conversation.
That's great. I mean, the fact that he was even able to foresee, because a year ago AI wasn't as used as it is today. Today, it's definitely more prime time today. That's great that he could foresee that. And it sounds like he basically was able to take the AI tool that you're talking about, and he trained it on all that content. So it's like him giving that content, which is great. I think there's a big need for that. You obviously done a great job in honoring your husband's legacy. What's next for you? Where do you kind of see the nonprofit going? How can people access the Mac? Talk to us about that a little bit.
Yeah, so you can go on the marshallallenproject.org, and that website houses the Mac. It's there, it's accessible, it's available. It also contains kind of the mission of our foundation, which really is to equip, empower, and educate healthcare consumers on how to navigate healthcare. There's 100 million Americans with medical debt, and a large percentage of people have medical debt in collections. So the financial strain and pressure of 100 million Americans, that's a lot of people. And the
Absolutely.
Mac is it's a resource, it's a tool that really can, like I said, equip people and educate people on what their recourse is for trying to handle these separate issues. So I would encourage people to go to marshallallenproject.org, and also you know, it's a nonprofit. We would love donations, but also we have partnerships that we're moving ahead with brokers who are working, to provide healthcare benefit or packages to employers. We're working with some school districts. We're working with individuals where for a license that we can sell a license that will enable us to embed the clone on their personal website, and we
I
can,
see.
can we can add in more information that is particular to their constituents of people. We have training that we'll do to help people understand how to ask these questions and what they can do to navigate it. We're working with patient advocates who, if you're on the Mac and you're asking the questions and you're doing the things and you still need additional help, we have patient advocates available who are going to help, walk people through that. So I'm really looking to move this, not just Marshall's legacy, but to really serve people, this group of people, as we, are trying to figure out what are the things, what are the tools that are available to me, what are the answers, how do I figure things out, and so, I'm very committed to that and to continue to just move Marshall's legacy forward. He was passionate about people. He loved people, and he spent a lot of his time serving and helping people for free. He would speak at a conference and he would put his email and he'd say, "Hey, email me if you need help." And I think, "Oh my goodness, you're going to get, covered in emails." And he did. He had a huge capacity for people, and was had just a heart to love and to serve. And so I'm just trying to move that forward as best as I can. I mean, Marshall was obviously the healthcare expert in the family, but I've been alongside of him, and I've been reading his books and his articles and listening to his conversations, and the last few years was able to travel with him and hear him speak. And so although I don't know everything that he knew, I know enough to be able to kind of move this forward and have these conversations.
That's
And
great.
so yeah, we're hopeful to really make a difference.
I'm sure you are, and I think it's phenomenal what you're doing to try to continue his mission. And I'm sure he'd be proud. So congratulations to you guys, and I wish you guys the best. I think it's a very important mission what you're doing. For us here, at our organization, we're really passionate about making sure patients get access to medications. And I think this is so important because the truth is, for a lot of people, healthcare is very confusing. It's very confusing. And having resources like this definitely helps. Sonja Allen, it was great having you on the podcast today. I really enjoyed the conversation. We'll make sure we put a link to the AI tool, a link to the website and to the book. But Sonja, it was great having you. Thanks for being here.
Thank you so much. I really appreciate this opportunity, and I'm grateful for the time we could spend together.